Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
So my question is about inflammation and also like previous, maybe like diagnosis that are related to inflammation and like how that affects the recovery. So just like very briefly, like since 2019, I've been diagnosed with endometriosis, and like shortly after that, I was diagnosed with ulcerative colitis. I had a colonoscopy last April, and my ulcerative colitis is like healed. Like the membrane of my colon is like healed, so I think that's good. But like the endometriosis is like, I don't know. There's not much. They just like take some hormones, and that's kind of the advice. So I have those pre-existing conditions. So like I am on the Concussion Fix Diet. Obviously, like during the Christmas break, I kind of, fell off the bandwagon. But I had done it for about like 2 months prior to that. And I didn't necessarily notice like an increase of symptoms like during the holiday season. Obviously the stomach is not doing great because you're eating like more fatty foods and like more sugar. So like I'm not doing that anymore, obviously. So like, is it just like that, Christmas food stuff that's like, okay, your stomach, but I didn't get a flare of like my other symptoms. And I guess my question is more like, what can I do since I have, from what I understand, pre-existing illnesses that are inflammatory?
Mm-hmm.
And like, I do understand that like the diet will help the overall the inflammation. So it's not just like the brain, but like, everything. So like, is there something specific, some advice that you would give? Like, is there some major impact, like, because I have these pre-existing illnesses, like I'm going to be stuck with like, persistent symptoms or like...
I think I understand your question. Thank you for sharing. So generally, pre-existing inflammation is a risk factor for any sort of trauma to flare that up.
Mm-hmm.
So, for example, if a person has an autoimmune condition, could be in your case ulcerative colitis, a person sustains a concussion or a motor vehicle accident or whatever it might be, it could even be a mental emotional trauma as well.
Mm-hmm.
Not to be physical, there's a chance that the underlying inflammation could also be exacerbated, which is a fancy way of saying getting worse.
Mm-hmm.
On the flip side also, that when you have autoimmune conditions, a person just is more predisposed to inflammation in general. And so that could also be contributing to symptoms that are in the PCS, persistent concussion symptom category.
Mm-hmm.
It doesn't mean you can't heal. It just means that you have to pay more attention.
Mm-hmm.
A good analogy would be to say that if a person's had a injury to a ligament previously, like I had a knee damage done, if you're going to get injured again, most likely the knee is predisposed to get injured again because those areas have that predisposition. What my suggestion to you is that making sure that all those existing conditions are as proactively treated as possible to keep those things in check, to not muddy the water with the PCS symptoms. I'll give you an example from what you've just shared. The ulcerative colitis is an inflammatory condition of the gut, of the lower intestines, and anybody that has any sort of gut, especially autoimmune conditions, you're going to have issues with certain foods that might be aggravating to it. You might have issues with intestinal permeability, and you might be more predisposed to, if you do eat more refined foods or do eat your triggers, then those symptoms might come back, or maybe a mild version of it. Some of the symptoms you might have described that you got over the holidays after just kind of falling off the diet. So the Concussion Fix Diet is the baseline here. meaning that it's what everyone should be kind of eating, but there may be some additional investigation and work that you might have to do to identify, okay, maybe we need to look at some more specific food sensitivities, like what foods did I eat over the holidays that triggered it? Is it just refined sugars? Because that is just an aggravator for everything, but it could have been dairy products, it could have been wheat products, it could be more alcohol. There's a whole host of things that you could be sensitive to. So the message is that we want to be more proactive. Inflammation is additive. It can be caused by past conditions, but it doesn't mean that you can't heal from that. I just would encourage you to really look at it, just look at everything with even more kind of commitment and work with that healthcare provider, like a naturopathic doctor or functional medicine doctor, to say, okay, I have these predispositions. How can I keep these inflammatory pathways in check that now I'm dealing with in PCS?
And do you know or have any recommendations for naturopathic doctors in the greater Montreal area? Because it's kind of, I guess, a field that's sometimes, how do you say, like, exploited in a, so like it's hard to trust, somebody. And in the past, like my ulcerative colitis, I am taking medication, I am careful of what I eat, and I've been in remission now for a while, so that's okay. But the endometriosis is a bit of a more difficult one, in which the treatment for doctors is hormonal therapy, which I've attempted in the past and felt absolutely horrible. So I'm kind of like not wanting to do that, but then I wonder, like, do you have, well, it's kind of a medical advice, so I don't know what you can say on that, but like, is it something that if I take it, like, my inflammation will go away, or is it just something that's like to treat pain? Like, I don't know. Like,
so I mean, we have to be careful with endometriosis. There's inflammatory components, but doesn't mean that it's not inflammatory in the same way that ulcerative colitis is, or even in the same way that a concussion is. Certain self-limiting inflammatory pathways that happen in the brain and in other tissues in the body after a concussion and or whiplash. So those things can still be addressed. I think that probably, to answer your first question, because of the multifaceted, different medications you're taking on for that you've tried in the past, you're taking for the ulcerative colitis, maybe just message me on the group, and I can guide you on where to find that additional help. It could be somebody locally, it could be somebody in Ontario, because you're so close. Because in Quebec, naturopathic medicine is not regulated, unfortunately, very well, as you said. So it's really hit and miss. Some good ones, but there's some really duds too.
Okay, thank you. And just one last question. In the previous question, you spoke about magnesium, and I kind of heard, and I don't know like what's the truth behind it or not, but like in taking certain supplements, like, if you have an excess of those supplements, there's like a negative side effect. And like, I was just wondering if magnesium is one of those, or is it something like kind of safe to take if you're not doing any like blood work follow-ups?
Did you get to the to that section in the course yet, Lauren, when we talked about supplements?
No.
Okay, so I do answer that there. So work your way through the course and get that. You're going to get a more complete answer there. But the short answer is that magnesium is one of the few supplements that really there's no good test for, and most people are deficient, and it's very well tolerated. So those three main reasons is why it's one of the most commonly prescribed supplements in my practice, and it's one of the most popular ones that are used by most people, because it's just very safe and well tolerated, and there's a lot of reason to take it. So that's not me giving you advice. You'll learn more about it in the course, but that magnesium is a pretty safe one.
Okay, thank you. Thanks so much.
You're welcome. Thanks for asking.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.